This is part 2 of a 10-part podcast on your electronic health record and taking control of your own health management. Enjoy the episode.
So, to give you an example, already in 2014, the EU brought out directives, which I will touch on later, that clearly encourages countries within the EU to start moving towards blockchain technology and get away from the current centralized and decentralized database structures, etc. They knew this was coming. So they started long ago with this. But was there the urge to change? Was there enough pressure to change? No, there wasn't until the pandemic hit.
But you said an interesting word there. You said they encouraged countries to move towards. So there's no real directive. This technology was existing.
Yeah.
There was electronic ways of managing information more efficiently, and they recommended that countries adopt these technologies, and many countries didn't.
Yeah.
Because there wasn't an immediate reason to change the way things, the status quo.
Some countries didn't adopt it and still have not adopted, but most countries, including Ireland, has started to move towards that. So in all fairness, in Ireland, we're very lucky that our HSE has created eHealth, and that is our department within the health system looking after the recreation or the creation of the electronic health record within Ireland. And there are certain processes that they currently work through. And this is something that the public should realize. Medical informatics is so complicated. It is super complicated when it comes to data protection, privacy, rights to certain information, blah, blah, blah. So it will take years to do that. And I do believe that Ireland is one of the 12 countries that 2019 actually illustrated that they have achieved the transfer of first electronic health records between systems. So yes, we have a plan in Ireland. The question is, was enough resources put behind it? Was it fit for purpose to be ready when the pandemic hits? And that is really what happened here, is that although the knowledge was out there, the principles, the designs were out there from an architectural point of view, but there was no urgency. Now, that has changed.
Okay.
Right. So what we do see is that you're going to see that governments, etc., would move towards this. So what is really different in here, if in our project, when we looked at the design and we did the research, we were in collaboration with a huge amount of universities in Brazil, in Taiwan, in China, Australia, the UK. We went everywhere and we did a proper research and in-depth analysis of what is out there, what is possible from a technology point of view, but also trying to understand how the client will perceive their medical information. What would the client like to have? And it was actually a fairly easy learning curve, because you just have to follow your WhatsApps to see what people don't like.
Okay.
It was very clear very quickly what people don't like, but what they would like to have had, or what they even suggest to be, and the better suggestions. And we actually learned a lot from that first phase of the lockdown, from what do we need to design. So we worked very closely with a great team of researchers and professor in Brazil, who really started to open our minds, because they're running it within the academic hospitals. And then finally we sourced and decided on our partnerships to help us to actually developing the blockchain part of it, right? And what we try to achieve here is a personal electronic health record.
Okay.
Now, the personal electronic health record is life-changing and can also be life-saving, in my opinion. And if the question is, if people had an electronic health record last year in February, March 2020, when this broke out, would the outcome have been different? Would less people have died? Would we have avoided lockdowns? Those are the questions that I can't answer. But this is what the study is about. We need to find out, because in all fairness, a study like this has never been accomplished in the world to our knowledge. And we've been working with many universities right across the globe. And to our knowledge, this will actually be a first of its kind study with real people taking part, having access to an electronic health record, being able to manage it and lock it and unlock it, and decide what do they want to share. So imagine a private and secure online banking facility that we all enjoy now, where you have the ability and the freedom to access your account whenever you want, from anywhere in the world, at any time. And you can have it on your PC or you can have it on your mobile phone, right? Imagine you can do exactly that, accessing your medical records. Imagine you can actually upload or warn or make aware if anything changes in your health status. Or imagine even that you can be communicated with from your health authority or your doctor or pharmacy, whatever. So we are talking here about something that is actually radically new in the mindset that has not been done before, and that is for you to manage your health records like you're managing your bank account.
Just in case people aren't aware how, because if anybody is actively involved in the healthcare system now, has an ongoing illness and they've had to be in and out, they might be familiar. But anybody who's not really keeping their finger on the pulse at the moment, the end user, us, the clients, the patients, aren't necessarily an active member in our own information. So in Ireland, I know we've moved to more of an e-system, but it's still quite, most countries, it's still very fragmented, where you go to your doctor, the doctor might pass the information on to the scan might pass it to the, but you're not really involved in that loop except as the client. So you're a little bit, you're very removed from the process. Yes. And in the context of what just happened, you and you're developing health or symptoms, you're not necessarily touching base regularly enough with that system for the system to have any real understanding of what's going on with the country or with the community or with the group of people. Yeah. And what you're talking about here is a way for me as the client and the end user, the patient, the individual, to be playing an active role in how my information is shared, not necessarily just for privacy reasons, but this is obviously a benefit you talk about, but I'm now part of a system that is using me, which is the most important point in that system, because I am the information, but I'm now actively contributing to that system.
Exactly.
And I'm connecting with my doctor and my pharmacist and my hospital and my scan and all these different parts. Yeah. And it's a much more kind of flowing up to date kind of relationship as opposed to what we currently do. Would that be a fair enough assessment of?
Correct. And most people would be interested. And if you ask them a question, would you like to have access to your records? Very few people will say no.
Yeah.
So we know that answer. And there's a huge amount of papers that backed the EU conclusion that we have to move to electronic health records.
Okay.
But the current design of the systems and what is encouraged in most countries is that the state or the government or the private health company or the private hospital will develop their own blockchain system, electronic health records. The information that is put into there is controlled by the hospital. The patient that visits that institution is just contributing.
Yeah.
They don't have access to that information. Now, GDPR has changed that a lot in the EU, because now suddenly you have a right to that access, which changed the ball game and the rules in the game here, and has actually opened the possibility for us to actually design and put in place a system where people will actually be able to manage that record.
Yeah.
Right. Now, most people at the moment that do keep records of their health records, they have photos on mobile phones.
Yeah.
They have emails. They have folders on their computer. They have filing cabinets. It's just all over the place at the moment. Now imagine you have one place where you can, with blockchain technology, security, lock and using your own key to unlock that information when you're on holiday in Mexico or in the Bahamas or in the UK. Wherever you are, you have access to your complete medical record. This is the vision.
Okay.
This is where we're going to. Eventually, not only having access to that information, but to be able to immediately share that on the spot, right, as needed.
Yeah.
If you're in an emergency situation in Caracas and you suddenly need to attend the emergency room, what is the value? Can you imagine the real value of being able to unlock your emergency information to the treating doctor there?
That's actually a great point, because I can, even in my own experience, count the amount of times I've been somewhere and to get a doctor or someone says, I need to know your history, and you're like, I'm gonna have to call Sam. He's
Yeah.
gonna have to go check his emails,
Yeah.
and it's really difficult to access the information. I think most people probably have had a similar experience.
Exactly. And imagine you have 3 or 4 children, and
Oh,
you need
yeah,
to be
yeah.
responsible for that as well.
And you've
you know.
seen 10 different specialists over the last 10 years with 10 different different concerns. Yeah, it makes a lot of sense.
Exactly. So the whole point that was brought this to the front is actually people now having to also keep the records of the vaccinations, of the COVID tests. Where the heck do you put that?
Yeah.
Where is it safe to put it? Take photos, and
Under
in
the
your
mattress.
airport, you're going to flick through your photos to show your
Yeah.
last COVID test, etc., etc. So we designed a year ago a system that should be robust, friendly, based on current knowledge. Right? We didn't invent any new knowledge. Right? We used current knowledge, and we actually went back and looked at what was suggested by literally, Dan, you won't believe this, thousands of publications where doctors were writing about electronic health records.
Wow.
The different designs of them are discussed, and it's in the open public, right? And that's why I say very little was acted upon.
Thank you for listening to part 2 of this 10-part series. If you'd like any further information on the topics of this podcast, or if you'd like to get involved with the research project, please contact Dr. Sam's team on reception@newacell.com.